Good morning to you, everyone. It's almost 7 o'clock here on the East Coast. I'm Anne-Marie Green. It's Friday. I hope it's already turning out to be a good one for you. We are going to get right into it. We begin this morning with President Biden's sweeping new COVID-19 vaccine mandates for many Americans across the country. He took aim at the unvaccinated during a major speech yesterday. The president rolled out his administration's new six-part strategy to fight the deadly virus as cases, hospitalizations, and deaths climb in some parts of the U.S. Under the new orders, all federal workers and contractors must now be vaccinated. Companies with more than 100 employees will also have to mandate vaccines and implement regular testing.
My job as president is to protect all Americans. I'm announcing that the Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated or show a negative test at least once a week.
So here to discuss all of this is Dr. Ezekiel Emanuel. He is the Vice Provost for Global Initiatives at University of Pennsylvania, and he's a member of President Biden's Transition COVID-19 Advisory Board. Thank you so much for joining us. So mandates, a bit of a controversial topic. Why are mandates, do you believe, the best strategy to curb the spread of COVID in this country?
Well, on July 31st, we finally got to 50% of the population vaccinated, and we've been sort of plateauing. We're now at 54% of the population vaccinated about 6 weeks later. We need to be up at about 85% of the population vaccinated, and we're having very slow uptake of the vaccine, despite the fact that it's very safe, it's effective, readily accessible, free, and people have been educated about all those facts, and it's been given to billions of people. It is a little strange that we have not had a more active uptake of a very effective vaccine, and mandates are one way to get it. And I think mandates in healthcare are a no-brainer, which the president called for, because those people care for others and have to put the interests of their patients first.
You are a medical professional. I'm sure you've spoken to other medical professionals. How are they responding to the announcement of these new mandates?
Well, I think medical professionals think it's important to have a mandate. About the end of July, we organized almost 60 medical professional societies, from doctors and nurses and pharmacists and home healthcare workers, endorsed a mandate for healthcare workers. And one of the things a mandate does is you can't have someone working at a hospital says, the hospital's mandating me, I don't want to work there, I'm going to go to a hospital that doesn't mandate me. It levels the playing field, as someone said, making sure all people are covered in the same job category.
Yeah, the president in his speech yesterday was pretty firm, forceful. He pointed the finger directly at unvaccinated Americans, blaming them for the surge that we're seeing in this country. You know, his quote was, "Your refusal has cost all of us, so please do the right thing." I'm sort of curious about that approach and whether you think that direct, firm approach is the kind of thing that will sway those who are vaccine hesitant. Dr. Anthony Fauci said earlier, I think yesterday, he was speaking to some HBCU students earlier in the week, and he said, pointing the blame like this, pointing a finger at the unvaccinated isn't necessarily the best approach. What do you think of the way the president delivered his six-point strategy?
Well, I think the fact of the matter is that we have tried almost everything short of a mandate. Again, it's readily available. Go to a pharmacy. It's free. We've been educating people who say they need more information, providing information, showing them that, in fact, again, billions of people have gotten this vaccine, and there have been no major side effects, and dispelling some very bad disinformation being provided by anti-vaxxers, like it can render someone infertile, it can cause problems years down the line. All of those have been dispelled. And yet people are still, I need more information. It's not clear what more information would persuade anyone. Mandates do work. They get people actually vaccinated, especially people who've been sitting on the fence. And I think that's pretty important. And the president, he's been pretty patient. We have a raging, everyone talks about COVID as a war. Well, one of the things you do in a war is draft people, because voluntary action isn't sufficient, especially in a large, diverse country like the United States. And I think he's done the right thing in mandating. I might even go further and mandate that we need to have a vaccine to travel interstate, whether to fly, take a train, take an interstate bus.
I was thinking, then what's next? First, for sure, there are going to be some fence sitters who are going to be like, all right, let's just go get it. I don't need any more information. I've waited long enough. But there's going to be other people, and you mentioned some of these conspiracy theories out there, that, this is not going to influence them. In fact, a mandate is going to have them digging in their heels even more. You've seen the criticism from some of the Republican lawmakers that have come out about the mandate. Is there another step for the holdouts? Or does it matter as long as we reach a certain threshold in this country when it comes to vaccinated population?
Well, you shouldn't be asking me, is there another step for the holdouts? I do think we've gone the extra mile in trying to persuade them. And no one wants to go to force someone to do something, right? You prefer people do it voluntarily because they've been educated and it's been made easy. But we're beyond that point. And I think another group that, we certainly should get vaccinated are kids between 12 and 17. We want to keep schools open. We want to keep middle schools and high schools open. Vaccinating those kids is probably the best way to ensure that they stay open, and also adding a mask mandate in schools.
So speaking of that, the Los Angeles Unified School District's Board of Education voted in favor of mandating vaccinations for the eligible students. All students 12 and older will need to be vaccinated by January to take in-person classes, and all teachers and staff will need to be fully vaccinated by October 15th. Obviously, you think this is the right move. Should this have been done earlier?
Yes, I think this should have been done earlier so that we could open in September in a totally safe environment. I work at the University of Pennsylvania. We put in a mandate for students, faculty, and staff, and I think that's exactly the right approach. Make the classroom as safe as possible. We have thousands of students, 50,000 students in Texas who've tested positive since school started, 20,000 in Louisiana. You've got thousands and tens of thousands of students testing positive because there isn't a mask mandate, there isn't a vaccine mandate 12 to 17-year-olds. And I think we should have started that early so we could start school as safe as possible and keep them open as long as possible.
You're the architect of Obamacare, the Affordable Care Act. You know that there was much legal wrangling over this law. Do you anticipate that these mandates will also face legal challenges?
Inevitably. I mean, you're going to have Republican governors and probably some anti-vaxxers. But I think there's been a spate of commentary by legal experts that mandates like this can be effective. The federal government does have authority over interstate commerce and activity, and there are places it can issue the mandate, certainly for healthcare workers who get federal money, certainly for federal employees, certainly for interstate travel, and certainly for employers to keep their workforce safe. And I think it'll withstand all these legal challenges. People who claim their freedom is being obstructed, the founding fathers would not recognize that argument at all. Thomas Jefferson, John Adams, they took inoculation against smallpox and they inoculated their family. George Washington inoculated the troops in Boston. they recognize that to stay healthy and stay safe in an infectious environment where your actions affect other people, getting people vaccinated was the right thing to do, and it wasn't a matter of freedom to infect others.
All right, Dr. Ezekiel Emanuel, thank you so much for joining us this morning.
Thank you. Nice to be with you.